So now we will discuss the physiology of heart. Okay, so in physiology of heart, one first of all thing is the auscultation of the heart. Okay, auscultation of the heart. We will explain the auscultation of the heart and abnormal heart sound. Okay, so there are, if you see your heart have two sound. One is S1 and one is S2. S1 is X1 is actually when they're in the tricuspid. This is actually S1. Okay, S1 sound. This is actually S1 sound. So S1 sound is produced from the tricuspid and mitral valve. What? From tricuspid and mitral valve. If there is tricuspid valve and mitral valve, when the blood flow in, okay, when the all blood come in and the tricuspid valve close. During closing, it produce a sound, and that sound is called S1 sound. Okay. After that, when the blood is pushed to the arteries, aorta and pulmonary trunk. Okay, after when the ventricle is empty, after emptying, the all blood goes to the pulmonary trunk and aorta. Okay, after that, the wall of aorta and pulmonary trunk become closed, and at that time another sound is produced, that is called second sound, S2 sound, that is called aortic and pulmonary sound. Okay, now let's come here, and there are two normal sound. One is S1 and S2. Okay, the normal sound is S1 and S2. So S1, where is the S1 occur in S2? S1 is, for example, S1 and S2 when the diastole end. Okay, all blood come into the ventricle. Okay, and the mitral valve close. At that time lump sound is produced. Okay, and after that the systole is started, and all blood goes toward the aorta and pulmonary trunk. Okay, when the blood goes toward that, after that, when the uh, when the aortic wall and pulmonary valve closes in S2, so the dub sound is produced, that is called S2. And after the S2 sound, for example, this valve closes, the mitral valve open, and the diastole start, all blood again going toward the heart. So this is about the normal sound of the heart. Okay, now after that there are two extra sound, that is called S3 and S4. So where is the S3 and where is the S4? So if you come to the S3, okay, for example, all the aorta wall and pulmonary wall is closes. Okay, at that time S2 sound is produced, mean dub sound is produced. Okay, when this sound is produced, so what will happen? For example, this sound is produced. Okay, so after that early diastole, when diastole is sound, at the early diastole, at the early time of diastole, there is another sound produced, that is called S3. So what's S3 mean here? For example, if you hear the S3 sound, it means that no more and lot of blood come into the ventricle during diastole. So a lot of blood come in early diastole, blood come to the atria. Okay, if the lot of blood come to the atria, it produce like a movement, this like, if you this like vibration, they move, come and back toward backside, just like a vibration, and this vibrant movement produce a second sound, a third sound, that is called S3 sound. Okay, so this is due to early, after the early diastole, and this is due to a lot of blood come. This is due to actually a lot of blood. Now this is S3, and S3 is actually normal. We are what at what time this is normal? If you hear the S3 sound, it may be normal in the athletes and pregnancy, because in the athletes a lot of blood coming in, so this is normal thing because they need a lot of blood and they can sustain, okay, with the, so this is normal and handed to extra, it mean membrane ventricle handed extra blood. The this is the ventricle have lot of blood come, but the membrane of the ventricle handed extra blood is come to it. Okay, so because extra blood is needed in the pregnancy and athletes, this is normal things. Another thing is the sign, it also show, for example, if you hear the S3 sound, so it's mean that volume overloaded, there are more volume come in. So if more volume come in, this may congestion of the heart and failure may occur. If too much volume come to the ventricle, okay, so the failure of the heart may occur. For example, this is the ventricle and they fill a lot. Okay, by the Fick principle, say if more blood come in, more blood out, but up to certain limit. But if the more blood come in, so they cannot expel out, and the failure, heart congestion of the heart, failure occur. Okay, now this is about the S3 sound. S3 sound. Now we will tell about the S4 sound. Okay, so what is about the S4 sound? So this is the S4 sound. At what time the S4 sound is heard? At what time the S4 sound is here? This is S4 sound. Okay. Actually, S4 sound is when the diastole ended. Okay. When the diastole, when the bloods come and diastole is ended, all blood come here. At the end of diastole, the S4 sound is here. Before the systole or end diastole, this sound is here. Okay. Actually, it is pressure overloaded or severe hypertension. We at what time the S4 sound is here? Actually, if there is more blood, more overload, more pressure or severe hypertension is present, so at that time S4 sound is here. So actually before the systole and diastole, atria contract. For example, this is your atria. Okay, these atria contract. Okay, because they need a first of all in diastole, you know, in diastole, for example, if diastole more blood come through simply. Okay, when the ventricle is full, when the ventricle is completed. Okay, so after that, through the atria is try to contract, atria contract, and more blood go toward the ventricle. Okay, so this is simple phenomena. But after when all blood come to the ventricle and the atria contract so strongly, why? Because ventricle is stiff. If the ventricle is stiff, this ventricle cannot expand. So here this thing, okay, these atria contract so much strong, and this strong movement and this strong pressure create a fourth sound that is called S4. So it is actually pressure overload or severe hypertension. For example, if this is the aorta, okay, this is the ventricle and this is the atria, blood come to the ventricle. Okay, now more blood needed to come from the atria, so atria start contracting, atria create a high pressure, and there in the aorta there is more pressure. If there is more pressure, so here more pressure is needed, that more pressure is needed to decrease the aorta, to increase from the pressure of the aorta. Okay, so at severe hypertension the S4 sound is hit, or pressure overloaded. If more blood, if the ventricle is stiff, the atria contract so much strong, so that's why the atria contract, ventricle stiff, so atria need high pressure. Okay, and it create a S4 sound. This is all thing. So S4 sound is also here in the hypertrophy, increase in the size. Okay, if the ventricle is increased, so the S4 sound may be here, so are in the high blood pressure patient. So this is about the abnormal sound. I have explained it completely to you. Now now come here to the other thing that is called, first thing is, let's start the abnormal sound. We have explained all the abnormal sound. Okay, now we will explain the heart sound, the heart murmur. Or murmur and sound is actually different thing. Murmur is just like a murmur. Okay, so result of turbulent or rough blood flow. For example, if you see a sea is actually silent, they are silently moving. Okay, if you see the river are so turbulent, the many noise come from the river. Okay, from that part of the water where is a narrow thing, so from the river etc, a turbulent sound is produced. Okay, depend on how loud this murmur is. Heart murmur depend on how high this murmur is. So grade from 1 to 6, actually it is a graded from 1 to 6. Okay, slightly. For example, if you said that this is 1, okay, it is slight possible murmur. If it is 2, it is moderate. If it is 6 track, it can heard without stethoscope. You don't need any stethoscope to hear this as 6 number heart murmur. Okay, so this is like a stages are graded from 1 to 6. If this is 1, it is slightly possible murmur. Okay, if it is 3, it is moderate. If it is 6, it can hear without stethoscope. Another thing is innocent murmur. Innocent murmur is actually in some children. If there is innocent murmur, okay, so what it means? Actually, it is in some children was heart are perfectly healthy. Okay, their heart are healthy, their heart are healthy. It's not abnormal sound. Why? Because the wall is thin, their wall of the heart is thin, so that's why a vibrant with the rushing blood is come. If blood is come here, okay, so the wall is actually thin, the wall is actually thin, so it contracts so much and expands so much. That's why it is thin, and thin wall, due to thin wall there is a vibrant movement create, and that is murmur produced in it. Now the second thing is the stills murmur. Okay, and in the children actually it is actually disappear in the children. Okay, now we have to discuss the still murmur. What is the still murmur? So still murmur is very common in the children, it is also common in the children. Okay, so it is common in the children. If it is common in the children, now let's talk about it more. Lift lower sternal, where it can hear. It is actually heard in the lift lower sternal border. Okay, lift lower, if this is your sternal, if lift lower sternal border, this can be heard. It is, if for example it is innocent, but it is not innocent, problem indicate in the heart. Okay, if if there is a maybe a problem in the heart actually, so it is not innocent murmur, it is not innocent. Sometimes due to thin wall it is innocent, but if this is heard in the common children, this may be not innocent, that is a may indicate a problem in the heart. Another thing is the systole murmur. Systole murmur is normally with the aorta and pulmonary wall open. When the aorta and pulmonary wall open, there is a systolic murmur produced. Okay, why? This is tricuspid or mitral wall closes. Okay, so systole murmur are due to four causes. One is not first cause is not able to fully aortic and pulmonary open. The first thing is that, for example, this is your aorta and pulmonary wall, this may not become open, so due to stenosis. Another is the mitral or tricuspid wall not fully closed, it is due to regurgitation. So first is the stenosis, another is the regurgitation. So this is actually the cause of the systolic murmur. Now let's come here and see the crescendo and decrescendo murmur. Now this is actually if resistance before snapping opening, ejection click. For example, ejection click is before the snapping open. When the wall is open at the mid, they create ejection click. Okay, so if the ejection click, another thing is increased turbulence or murmur. Okay, so what is crescendo decrescendo murmur? Crescendo decrescendo murmur because the murmur increase and then decrease. This is called crescendo decrescendo murmur. Okay, initially louder as more blood come, okay, and squeeze throughly. So first of all there is increase louder, then decrease. Okay, so this is actually crescendo decrescendo murmur. Now we will tell about more about the other reason is the aortic wall stenosis. There may be aortic wall stenosis. In aortic wall stenosis, burst heard at the between third and second and third right central intercostal muscle. For example, this is the right second intercostal space. Okay, so there is the aortic wall stenosis may be here if there is aortic wall stenosis. Okay, stenosis mean this is the area the blood come through this area, so they push the blood and this create a stenosis murmur. This the more blood not move on, so it is called stenosis, and it create aortic walls. It create a murmur. Okay, another is the regurgitation or insufficiency. For example, if the blood come here and this wall is needed to close but it can't close, so blood move out, and this is called regurgitation. Okay, so there are two regurgitation, one is mitral, another is tricuspid. For example, mitral or tricuspid can't close completely, so the blood move back. Okay, another is the holosystolic due to regurgitation, holosystolic murmur, blood flowing for the duration of systole. During systole, the blood also move to the atria, so this is called holosystolic murmur. Now click, now we will ask, tell that there is actually mitral wall prolapse murmur. For example, in S1, when the systole start at the mid the atrial wall, the more the blood moves out of the ventricle. For example, this is the ventricle, this is the atria. Okay, during systole the blood needed to move out like this, okay, to the aorta, so blood also move out, but during at the mid of the systole the blood is also moved toward the atria, so this create a mitral wall prolapse, okay, or mid click. So this mid click also increase or also move, also go toward the go early and this early and before. How? For example, during squatting, okay, for example, if you squatting like a squatting, just like sit here, just like you are sit like this, okay, and grip your hand, so it increase your venous return. When venous return is increased, so it take longer of the leaflet to get forced to mitrum. For example, there is the mitral wall like this, okay, so if they the for example the more blood come in, okay, so this first of all the blood move out from the ventricle, okay, blood move out from the ventricle and they push the blood through this wall. But if the blood is more, the sound will heard, the sound will heard sometime later, okay, the sound will hear sometime later, because actually first of all the blood is moving, and at the last the wall is closed. First blood move plus first blood move and then wall closing, so that's why it closes lately, that's why it is called the sound is heard so late. And another is the if the click move early, how it happen. For example, after standing a valsa maneuver, for example in valsa maneuver the venous return is decreased, okay, when the venous return is decreased, for example the venous return is decreased, so what will happen at that time. The thing is you have to understand that when the venous return is decreases, okay, okay, here you have to understand how the venous return is decreasing. For example, the venous return is decreases, so less blood come to the heart, so it contract, so it contract, and the leaflet, for example this is the leaflet move out at the early stem because there is less blood and they can contract easily, so the leaflet at early time they move out toward outside, okay, and this create a early click, okay, so this is actually like the early click and the late click, okay. So squatting, how squatting standing effect. So squatting increase the venous return, full left ventricle become full, okay. Takes longer for the leaflet to get forced into atrium. Actually, the reason is this. Why in the squatting and the standing venous return is decreased, so it take longer for the leaflet. This is one leaflet, this is another leaflet. So if they move back, so it will take longer time for the leaflet to get forced into the atrium, okay. If they force to the atrium, it take longer time. If the venous return is decreased, left ventricle is smaller, so left ventricle is smaller and leaflet force earlier. So this is the simple reason behind it. Now come here and see the aortic stenosis, the different sound here, okay. So the aortic stenosis sound is here at the right second intercostal space, okay, aortic second intercostal space, and the pulmonary wall stenosis is here at the left side, okay, also at the second intercostal space but to the left. Now there is tricuspid and tricuspid regurgitation and mitral wall regurgitation. So tricuspid wall regurgitation is between fourth and fifth intercostal space, okay, and mitral wall is actually mitral wall is actually mitral wall is actually here at the mid clavicular line at the fifth intercostal space, okay. So it also have Carolus sign. Carolus sign is the murmur louder with inhalation. Murmur louder with inhalation. If the tricuspid wall regurgitation are present, so the murmur also increase with the inhalation. Why? Because inhalation negative pressures increase, negative pressure more blood into the right atrium. Negative pressure increases and more blood come into the right atrium. So murmur sound increase due to more blood come. Okay. Now there are mitral valve regurgitation. So mitral valve regurgitation is actually leading cause of mitral valve prolapse. Okay. And late systolic murmur have a mid systolic click. Actually it have a mid systolic click. Mitral valve is maybe mid systolic curve, leading mitral valve, also mitral valve prolapse. Okay, another thing, late systolic murmur. So these all things we have discussed here, that late systolic murmur, all things we have already discussed. Okay. Now come here and to hypertrophic obstruction cardiomyopathy. Hypertrophic obstruction cardiomyopathy means systolic murmur, crescendo, decrescendo murmur. If there is the intraventricular septum grow, if the intraventricular septum grow, obstruction flow. So there is the, for example, if there is the flow become obstruct. Okay, blood force through the small opening. If now there is small opening, so at that small opening blood is need to force, blood is need to force. Okay, blood is need to force, blood force through the tiny opening. Okay, the create a murmur, get louder when more blood rush out. Okay, another is softer when less blood is left. So this is about the obstruction. Intensity change depend on the squatting and hand grip. I have already discussed how can it increase. So in squatting and hand grip, the system vascular resistance increase. So if the vascular resistance decrease, the afterload is also increase. Afterload means when the blood, at how much pressure the blood is need to move from the ventricle to the aorta. This is afterload. So afterload increase, so less ventricle stretch out, less obstruction, murmur. If the afterload is increased, so there are less the ventricle is stretched out at less. They will stretch less. Okay, how? Because the blood is come here. Okay, and only less blood is moved out. So if less blood is moved, so it means less obstruction is present and murmur is less intense. Murmurs become will be less. Okay, now another thing is standing or standing. So standing decrease the afterload, so it also decrease the venous return. Okay, if the venous return is decreases, left ventricle less stretch out. Actually the left ventricle less stretch out, so it have less their obstruction increases and murmur also increase with intensity. Okay, like I see, for example, if water increases, intensity decreases. Okay, if water decreases, obstruction increases. Just like a river, you have to understand this. How? For example, first of all, understanding after load increases, after load decreases. Okay, and venous return in valsa maneuver, venous return is decreases. If it decreases, mean water or blood is decreases. If blood is decreases, so the obstruction is increased. There is a inverse relation. Blood flow, blood is inversely proportional to obstruction. If blood is increases, obstruction is decreases. Here, for example, in squatting or hand grip, the vascular resistance is decreased after load is increased. Okay, but also the blood is also increased. So it may be, it here may be less obstruction and murmur is less. So it is about the things. Okay, now we will explain the other thing, that is the murmur, different type of murmur.